So our last presentation in this group is Carolyn Sparks. And Carolyn, we're just going to pin you on the screen. Good to see you. Pandemic impacts on rural recreation in the Yukon Territory. Go ahead.
That's great. And I'll just let you know when we go from one slide to the next.
You. Just one
okay.
Oh,
okay.
Yeah.
Can you hear me okay now?
Yes, go ahead.
Perfect. Well, thank you so much for zooming me in. It's actually been a really great way to watch everybody's presentation. So kudos to balancing the in-person and the Zoom. It's working great. If we can start, I can't see the slides on your screen, but can everybody else see the slides?
They're just coming. 2 seconds.
Okay, well, I'll start by introducing myself then, so while we get them up. So hello, everyone. Nice to meet you through electronic means. My name is Caroline Sparks, and I'm here on behalf of the Recreation and Parks Association, along with Ann Morgan, who's the RPAY is a nonprofit organization that supports Yukon communities to engage their citizens in active, healthy lifestyles through recreation and parks. RPAY works with communities, government, and national organizations, and recently celebrated its 30th anniversary. A little bit about myself, I actually live here on the traditional territories of the Kwanlin First Nation and Tonquachin Council, and I've worked in recreation, sport, physical activity for a long time. I won't date myself too much, but across all 3 territories. So, and I was handing out volunteer jackets for Arctic Winter Games when the announcement needed to be made to all the people getting their jackets that Arctic Winter Games had been canceled. So it was a little bit of a shock to all of us in the sport and recreation world. And the way that events unfolded after that were quite challenging. And our communities need a lot of help to navigate that. So I'm grateful to have this opportunity to share with you some of what we learned about the impacts of the pandemic on recreation in rural Yukon. So over the next 14 minutes or so, I'll introduce our project, share some of what we learned from our 5 communities, and describe what we came to understand as what I'll refer to as the need for more resilient recreation. And I see that as resilient recreation that will support health and well-being, particularly when like they were during the pandemic. So if we could go to the next slide, please. So the next slide gives some acknowledgement. Multiple communities. We need to say a big thank you to the residents from Beaver Creek, Carcross, Dawson City, Pelly Crossing, and Tagish, who were so welcoming and who shared their experiences with our team. And thank you also to Sabrina and Monique for your amazing support, and also for the opportunity today to hear firsthand from other projects. It's really great to listen to some of the overlap. This project was a collaboration. So pandemic impacts on rural recreation in the Yukon Territory. World Leisure Center of Excellence at VIU, which is Vancouver Island University. And the World Leisure Center is one of its kind in Canada, and there's actually only 5 centers globally. That way. And at RPAY, we were fortunate to make the connection with Dr. Aggie Wayhill at VIU. And she recruited a team of several undergrad and a graduate student. And they were super enthusiastic, they were friendly, and fortunately, most of them had grown up in small northern BC, so they got rural Yukon a lot more quickly than what we expected, so kudos to them. Our programs mostly take place in rural Yukon. So RPAY had the connections and were able to help connect Aggie's team to the people in the communities that would provide the support and make it possible to visit the community and meet with the right community members. We also, RPAY's job was also to make sure that the team had food and a place to stay. You can imagine, places like Pelly Crossing are sometimes challenging to find accommodation for up to 7 days per community. And RPAY was able to join the research team when they visited communities. I think this was really important because sharing knowledge, sharing experiences all stems from good relationships. So, we also brought food, which, as you all know, is a really important part of any visits to communities. And we were able to hand out fun things like frisbees. And in some cases, we gifted the bug tent that we used for interviews back to the community for them to use for future recreation programming. So if we can move to the next slide. This one shows our 3 research questions, what we're inquiring or wanting to know. And really, through the research, we wanted to gain a deeper understanding of how the pandemic impacted recreation in rural Yukon. I won't even go into all the details about how everybody knows the differences between communities and Whitehorse, and recreation is the same as a lot of the other services. It happens differently, there's different barriers and different opportunities actually in rural communities than in Whitehorse. So there are always 2 sides to every story. So what we set out to do with the first 2 questions is to explore ways that recreation providers adapted their service delivery when they could during the pandemic, and ways in which Yukoners' participation in recreation or their patterns of participation changed during that time. These questions were important to understand for us because in our work in our sector, and as many of you probably know, recreation is really essential. There's many positive benefits from recreation that impact and touch on each and every one of our lives. So we wanted to understand that critical role of recreation and the way it can fill or help communities not only recover from some of the pandemic impacts, but also mitigate future challenges that will arise. So this third question is important to answer, not only for RPAY, but also for anyone who's involved in some way in the delivery of recreation in the Yukon. If you consider the impact, and I know that somehow the pandemic impacted your recreation when abruptly your access to recreation programs and indoor facilities was cut off. And then consider how those impacts that you, if you live in Whitehorse, for example, or down south, how much more magnified those impacts were in our small rural communities. Our research questions were designed to help us identify what happened and figure out what worked. So as I mentioned a little earlier, our theory was that if we knew what Yukoners turn to for recreation when it's not provided for them, then we will be in a much better position to sustain meaningful recreation opportunities when challenges arise in the future. So it's our hope that through this research and through the recommendations and what we came to understand will prompt some movement from a way of delivering recreation that was kind of established back in the 70s, which, yes, is a long time ago, to a better way that not only better serves the system, but also serves the interests and builds on the strengths that we find in our rural Yukon communities. Because recreation is different from community to community, so we have to find a way to support that. So if we go on to the next slide, I'll explain a little bit about our design. I have to give a bit of background here. So sorry about the legislative piece, but the Yukon has a somewhat complicated way of supporting community recreation as compared to other jurisdictions across the country. Our legislation, which is the Yukon Recreation Act, designates a total of 19 local authorities for recreation. And you're probably trying to figure out, well, how many communities are in the Yukon, and is there one for each community? And it doesn't quite match up that way. But 8 of the 19 local authorities are municipalities, so each municipality is a local authority. But the remaining local authorities might be a First Nation or they might be a community association. And this is a little challenging because the legislation also drives who gets funding for recreation. So from our perspective, when we knew the Yukon system of how recreation sort of comes down, we knew that we needed to invite different rural communities to participate. So we were absolutely thrilled to have 5. We planned for 2, but we got 5. So 5 communities, 3 more than we planned for. So 5 local authorities for recreation, and also when it was appropriate, the First Nation as well in that community invited us into their community. So of those 5, 1 was a municipality, and among the 4 unincorporated communities, 2 have a First Nation as their local authority for recreation, and the other 2 have community associations. So to ensure the diversity of rural Yukon and the voices of residents were reflected in the research, we chose a community-based or participatory approach, very similar to what many of you have already described. We used a series of 8 modified world cafes and conducted 28 semi-structured interviews. And I'm saying we, I shouldn't say we, Aggie and her team did all this work. So I can't take credit for that part of it. The data analysis did take time as all the interviews were transcribed, and then responses were sorted thematically that related back to each of our research questions. So each community actually got its own report, and the team tried really hard to get that back to the community when they were still there or within a few days of being there. And that gave the community an opportunity to review and validate or ask for changes as far as the summary of what they had shared. So several communities are already finding their individual reports useful for planning purposes, particularly planning for recreation infrastructure or facilities. At the end of the project, Dr. Aggie Wayhill and her team prepared a final report, and you can find that. I'll give you the link at the end of the presentation, and it presents a series of recommendations that we believe will interest decision makers, service providers, and the sector in general. So if we move on to the next slide, you can see that we had some learnings about the impacts of the pandemic on recreation, participation, and on the delivery of recreation. As you can imagine, public health restrictions had by far the biggest impact on service delivery and on participation. So the guidelines and mandates that were put in place around the size of gatherings and access to public spaces limited public interaction, which in rural communities meant that pretty much all of the organized recreation programs were canceled and all of the public recreation facilities were closed. So from everything being open to closed, not anything in between, although there were shifts as the mandates changed and as vaccine mandates came in. Recreation service providers often had to enforce vaccine passports and deny residents access to the facilities, which led to some confusion and frustration around who really was responsible for the mandate. So, there was that perception that perhaps it was the community or the recreation department that was making that decision. We did hear that in all people, like of all ages, in all 5 communities, experience greater social isolation as a result of these shutdowns through the pandemic. When vaccine mandates and passports came in, some residents felt further excluded. And in a couple of communities, that led to a division that's resulted in the permanent loss of key volunteers. And volunteers are so important for recreation in our small communities. We also heard how, in the absence of facilities and programs, rural residents turned back to the land. They turned to outdoor, unstructured recreation in summer and winter. So communities with outdoor infrastructure like outdoor rinks, trails, fields, playgrounds, observed actually a dramatic increased use of these spaces. So efforts to improve trails in Tagish and in Dawson, where they built a disc golf course and a skate park, show us that this type of infrastructure development is essential, because what it does is it promotes self-led, unstructured participation in recreation and physical activity. So that's a key from this research. Residents in all 5 communities also told us again and again about the importance of social recreation, or recreation that made people feel like they belong and built relationships in a community. So it doesn't matter if it's a monthly pancake breakfast in Tagish, darts in Beaver Creek, or hockey in Dawson City. Recreation is so important to health and well-being. So on the next slide then, what did we come to understand? Okay, I've got a 1-minute warning, so I'll go really quick. I don't know when that popped up, but I'll go as fast as I can. So the research findings basically confirmed that recreation provides a pathway for communities and individuals to come together and recover from the impacts of the pandemic. We came to understand that we need to think about and do recreation differently. We need to be more intentional and more strategic, more inclusive, especially of those people who aren't already included in recreation. We also learned that recreation will be more resilient when people have good access to self-directed recreation, recreation that they can do on their own time and at their own pace, when they have access to recreation over their lives. Bathrooms and things like that. And lastly, we learned that recreation will be more resilient when we stop placing a burden on communities by investing huge amounts of capital funds into infrastructure that's very expensive for communities to build, maintain, operate, and staff. I got 2 last quick slides, but I'll go really fast. So if we can go to the next slide. I'd just like to ask you to take a look at this picture. It tells me exactly what recreation does for us. So take a moment to reflect on the meaning and value of recreation in your community. This is a snapshot from a film that RPAY produced with Midnight Light. And Quanah from Beaver Creek says recreation is good for the soul. And that, to me, that just summarizes what recreation does in our communities. So the next slide, and I'll invite you to explore these on your own, but we came up with a series of policies, or not policies, but a series of categories that capture 10 broad recommendations linked to policy places, which is infrastructure, people, and programs. And Anne and I would be happy to answer more questions about these during a break or later on or at another point in time. And you can also read these in our final report, which is shown on the next slide. You can see the links to RPAY and the research. And if you want to know more about why recreation is just good for your community, for health and well-being, then take a look at the 20-minute film, The Recreation Effect, that just was released in April. So thank you very much. Apologies for going a little over time.